Hi everybody, Dr. Tevlin here again from Aspire Chiropractic with Dr. Christine, and we went over our first video. You can check out our knee assessment video. So we did that, and then now we're going to show Dr. Christine and you guys how to strengthen the knee and prevent any knee pain or to help with your knee pain. So first one I like to do is just a simple leg raise. So have you go ahead, lay on back. And then I usually tell the patient to bend one knee up to help take pressure off the low back. And then we're gonna start by flexing the toe up towards the head, okay? That starts to contract the quad here, okay? And then in particular, we wanna work on the, most people have issues with the medial quad, okay? So Dr. Christine's just gonna sit and do as many leg lifts about a foot off the ground as she can. Just a nice, slow, repetitive motion. And I like to keep track of how many I do because it's kind of nice to see, like I could do 30 on one and then the other one you can only do 20. So it just kind of shows you your weak areas, okay? A little bit lower, yeah, just a foot off the ground. Otherwise you'll start recruiting your hip flexors, which are usually already tight. So you're just gonna remember to keep your foot flexed back up, good. And then you're just gonna max it out until you feel like you can't do any more, and then you'll switch sides. Okay, so that's the first one. And then this one you can either sit up, Dr. Christine, or lay down, but I'm gonna have you do this one. All right, again, we're working on the medial quad, okay? And that only fires within the last 3 to 5 degrees of full extension, okay? So what we're gonna have her do is just push her knee down into the table and hold for 5 seconds and then relax. So, and then, yep, and then go ahead and flex and push and hold. 1, 2, 3, 4, 5, and relax. And then you're gonna do that 6 times. And then obviously do both sides. So if your right knee hurts, always do the left too, because it's better to be preventative. And usually there's a reason why one knee hurts. It doesn't mean that that knee is necessarily bad. It could be a problem with the left hip, for example. So the next one we're gonna do is work on the glutes and hamstrings. Okay, so our hamstrings come down and they cross the knee joint and they insert right behind the knee, below the knee joint, okay? And your calves come up and they cross the knee joint and they insert above your knee joint. So there's so many things that affect how the patella is tracking and the knee is functioning. So calf raises would be really good on a stair. We won't show you those because it seems pretty self-explanatory. Do as many as you can on each side. This one we're gonna use what's called a booty band. And we're gonna have Dr. Christine put it around your knees. Okay. And this is gonna be a hamstring bridge. So Dr. Christine's gonna lay on back. And the reason for the booty band is to help accentuate the glute medius muscle, okay? So she's gonna bring her feet a little closer to her butt and she's gonna lift her hips up, good. And then she's gonna keep pushing out with her knees, which is gonna accentuate the outsides of your butt cheeks, which are the glute medius muscles, all right? And then she's gonna hold that for about 45 seconds and then she's gonna relax. And then she's gonna repeat that one more time. So that's working the hamstrings, which is right here, and then the glute medius muscles. Okay, so those are our main go-tos for knee pain. We got our hamstring bridges, you can go ahead and relax, and our leg lifts, and then the one where you're pushing your knee into the table, okay? If you have any questions, always feel free to give our office a call. We'd be happy to show you in person how to do those. And you can ask as many questions as you like. All right, have a great afternoon. Bye. Bye.